Hi, I am Simone French. I am the current program director at the University Hospital of the West Indies for the DM program in emergency medicine, which is our graduate program in emergency medicine. I was up until recently the medical director of that emergency department at the University Hospital of the West Indies, and I am a trained sonographer. I am very happy to be involved with the JAHJAH Foundation. I was actually part of the planning team along with Dr. Dixon and colleagues. And one of my main tasks was to foster my residents who presented for the first time at the conference, and they did very well. Right, so this is not the first time that we have had ultrasound presentations from the graduate students in emergency medicine at a JAHJAH Foundation led event. Right. So during the pandemic, when we were forced online, a team of my doctors, supported by me, participated in an online conference that was hosted by the JAHJAH Foundation, and they did very well. It is good to see our young budding emergency physicians not only get comfortable with learning ultrasound, but also become the stewards by gathering those skills and getting the opportunity to present as the educators of ultrasound skills for the future. So it's very gratifying. Yes, and indeed modern education is really about the teacher being more of a facilitator and being willing to learn when it is necessary. We are in a different practice environment from the Jacobi team, and so there may be pathologies that we see more frequently or more recently than that team. And I think it is really great, the spirit of the team, to really just embrace that, not to have any attitudes about it. And it also builds the confidence of those young doctors who are, a little earlier along in that pathway of honing their ultrasound skills. So I think it's great. This is really the way that ultrasound is going. This is the way that ultrasound is developing globally. There may come a time where our stethoscopes are secondary, if not obsolete, as a result of handheld ultrasound. So we're really on the cutting edge. And I really want to thank both JAHJAH Foundation, but most specifically Wendy Hart and the American Friends of Jamaica, who really, without their support, this project, which was really conceptualized by the CEO of JAHJAH Foundation, Trevor Dixon, who pulled some of us on board to help him realize that vision. But I really want to thank them because, quite honestly, dreams without financial support are often dead. Right now, we have a very energized group of participants. We have the technology. We have the iPads that we need to be able to see the pathology in the patients. We will have to be very good stewards of these devices, but I'm hopeful, I'm very optimistic that these young people that we're training today will do a good job, so that next year when you come, you'll be able to bring us 24 more machines, and we'll be able to expand the program, because right now I believe we have 6 hospitals involved as a pilot. Our real aim is to expand that program right across the 23 hospitals in the island, so that this technology can be available to all patients who visit emergency departments. Even where formal radiology is available, bedside point of care ultrasound greatly enhances the rapidity with which we can diagnose serious illnesses, and so it makes a tangible difference in the outcome of our patients. It's a great initiative, and it is something that has grown over the 15 years. I was not there at the beginning in terms of my involvement personally, but certainly from the very beginning, Dr. Wong ensured that the University Hospital was involved in that. We have been sending residents for training through the entire time that the program has been in place. I think Trevor must really be commended for his vision. It is easy to be discouraged, because you know how it is. Sometimes things don't move at the speed that we would like, and what we envisioned that would take 6 months or a year might take 3. But he's persistent, and he's also quite good at gathering support. And certainly you would have heard the testimonials of some of the doctors who have worked not just at University Hospital but outside, as to the impact that the skills that they would have gained at a JAHJAH Foundation course has had on their patient care. It is really a game changer. Ultrasound skills are really a game changer when applied at the bedside. We don't scan in the same way as radiologists do, so we're really looking at quick scans that can bring a specific impact, diagnose specific conditions in a timely manner that allow us to impact patient care. And in low resource settings where other diagnostic tools might not be readily available, point of care ultrasound can allow us to advance a patient's care to their benefit while we can wait for those confirmatory tests. Right, so I was actually the very first emergency medicine physician trained in point of care ultrasound in Jamaica.
In Jamaica?
In Jamaica, yes.
Wow.
In my time, so just a little history. Dr. Wong and I are alumni of the very first class of persons trained as emergency physicians in Jamaica. We were classmates, we were batchmates, and while in residency, I developed an interest in point of care ultrasound and paid my money to go to Texas, it was at the time, to enroll in a course. And on returning, I was so energized by the concept of point of care ultrasound that upon graduation, I immediately enrolled myself in a sonography course. So I'm actually a trained sonographer, and I'm the first person here to be trained as such. And I then took that training and embedded it in the graduate program so that our doctors who are training as emergency physicians receive ultrasound training while they're in the 4-year program.
So you're a pioneer.
I guess so. It's nice. It's hard for me to use those terms to describe myself, but it is kind of you to say so. I'm just happy that it was able to bring benefit to my students, first and foremost, and to the patients.
Well, you're one of Jamaica's medical champions, and we're very happy to have you here. And we want to thank you for your great service to our beautiful country. Keep up a great job, all right?
Thank you so very much. I appreciate that.
All right, have a good one.